Hi everyone, thanks for joining us for today's 1 hour webinar hosted by Prevention Plus Wellness. My name is Dr. Chudley Wirch and I'm CEO and founder at Prevention Plus Wellness LLC, located in beautiful St. Augustine, Florida. I'm looking out my window, it's sunny, it's already 81. Woo, so it's gone from into summer very quickly, and I hope it's nice where you guys are at, and spring is there. If it's not, that it's coming soon for you. And today's session, as you can see, one session: substance use prevention plus wellness programs and media campaigns. This is an updated presentation to reflect a number of changes, including the addition of our new media campaigns for alcohol, e-cigarettes, marijuana, and opioids. And so we're going to have an hour together. As we go through the session, please feel free and comfortable to go ahead and type any questions or comments you have in the chat space or in the Q&A space. Excuse me, and we'll get to those toward the end of today's session. So you will receive a copy of these slides, so no worries. You'll receive a link to this recorded session. So if you need to go, there's an emergency, there's something, you'll get that. And both of those, I'd really like you to do me a favor and share those widely with your colleagues in your region and your state. So we get the word out, the word on the good news about these amazing integrated prevention plus wellness programs. So you'll be getting also a certificate, 1 hour CEU certificate for today. Okay. If you have any questions, again, anytime, find your toolbar, find your link for your chat or your Q&A and type that in. Okay, anything we need to discuss before we launch? I'm going to jump right into it with the objectives. There's 3 of them today. The first is sort of the core message that we've been trying to get out and have been getting out over the last dozen years or so at Prevention Plus Wellness, and that is the critical need for us prevention specialists and health specialists, parents, teachers, coaches, etc., everyone who works with youth and young adults, to address not just substance use prevention, but chronic disease prevention, and even better, to integrate those within single programs and media campaigns. So you could have more cost-effective and broader reaching programs for your youth, for your young adults, for your parents. And so that's why we'll focus on the need to address chronic disease risks and substance use, which are so prevalent among our today's youth. Secondly, we're going to look at the very unique characteristics that differentiate Prevention Plus Wellness programs and media campaigns from other types of substance use and wellness programs and campaigns for improving the overall mental and physical well-being of our young people. And thirdly, we're going to review research and theory and practice, which supports Prevention Plus Wellness programs and media campaigns as practical, evidence-based, multiple risk behavior strategies. Okay, so let's go ahead and dive right into it, starting with number 1, that first objective: youth multiple health risk behaviors. There's plenty of evidence, and I'm sure many of you, if not all of you, are familiar with the National Youth Risk Behavior Survey data, probably even data from your own region or state with regard to substance use. And this measure here, these measures you're looking at are the percentage of ever using a substance. And of course, typically this has been the case for decades. Alcohol is the most widely used substance. 6 out of 10 high school adolescents throughout the United States have tried alcohol sometime in their lives, and half have tried e-cigarettes, vaped e-cigarettes, and over 1/3 have tried marijuana, 1/4 have tried cigarettes, and 14+% have tried non-medical opioids. So that's sort of the the layout with regard to substance use for high school adolescents in the United States. But at the same time, many chronic disease risks that are even more prevalent among our high school adolescents. As you can see here, 3 out of 4 adolescents in the US are getting less than 8 hours of sleep. 8 hours is the recommended amount. Some youth need more than that. And 3 out of 4 are not getting 8 hours on a daily basis. Almost 7 out of 10 are drinking soda, just really, wasted calories, leading to weight gain. Over 40% are eating less than 1 fruit and 1 vegetable a day. They should be having a combination of 5. It should be 2 fruits and 3 vegetables a day. So critical to development of body and brain and functioning, and really, really underperforming. We're really a nation of non-fruit and vegetable eating human beings. So really, and that includes adults as well. Now, how about eating breakfast? Only a third eat breakfast every day. And we're not even talking about what's the quality of that breakfast. Does it have 3 or more food groups? Is it a good breakfast, a healthy breakfast that will help fuel the youth throughout the day? And only a third are eating breakfast every day. Less than a quarter are getting the required amount of physical activity every day. That is 1 hour of physical activity is the minimum required according to Centers for Disease Control and other health and fitness organizations for youth. And going on 50% are playing video games online quite a bit. So that's sort of a snapshot of those kinds of risks that are associated over time with the development of chronic diseases like heart disease, stroke, diabetes, osteoporosis, etc. A lot of things. So there was a really good study published in 2016 looking at the longitudinal patterns of adolescent health risk behaviors. And they started out saying, hey, there's plenty of evidence already showing that adolescents are experiencing multiple health risks, not just substance use, not just one substance use, multiple substances and multiple chronic diseases. This study, this national study, found that less than 4.2% of all the adolescents studied met all 8 health behavior guidelines. So very, very, very few in youth are ticking off and achieving all of those healthy guidelines that we were just talking about. And yet over 10%, over 1 in 10 had greater than 5 risk factors at the same time at age 16. And of course, we'd expect that to go up at age 17 and 18 as risk typically increases. This study under number 4 found that not eating fruits and vegetables, not eating breakfast, being overweight, being physically inactive, and smoking all predicted other health risk behaviors. So these researchers concluded prevention targeting multiple risk behaviors for all adolescents is needed. Great study published back in 2016. There's plenty of benefits of a healthy lifestyle, healthy lifestyle being plenty of sleep, physical activity, healthy eating, and there's a whole list of things from research. So number 1, probably most relevant to us as prevention specialists, to you as prevention specialists and mental health providers, less depression, less anxiety, less unsafe sex, and less alcohol, tobacco, illicit drug use for those that are living a healthy lifestyle. And you can see the other benefits of healthy lifestyle: improved physical and mental development and quality of life, and better self-image, self-esteem, regulation, confidence, etc. Greater brain development, cognitive functioning, opportunities to socialize and have fun, greater academic success. Yes, a healthy lifestyle is associated with greater academic success, and that's measured in terms of less suspensions, greater school attendance, less dropouts, and greater likelihood to attend and complete college, and then less chronic disease, as I mentioned earlier. That's number 7, heart disease, diabetes, cancer, stroke, etc. That's why we at Prevention Plus Wellness came up with this, what we call this integrative, interconnected model for promoting youth wellness or youth positive development. If you look at the left-hand side, you got the blue ball, that's substance use prevention. And directly below that, if you add to that chronic disease prevention, if we have programs that do both within that program or within that media campaign, aimed at both preventing substance use and chronic diseases together, that will allow you to increase that red ball, which is mental and physical health, improve mental and physical health. And then improving mental and physical health will also support substance use prevention and chronic disease prevention. So it's an interconnected and integrated model. And so, but the key is to have programs and to have campaigns and to have strategies that integrate substance use prevention with chronic disease prevention. So you're addressing multiple health risks common among young people. So what's the evidence in terms of the effectiveness, the efficacy of multiple risk behavior programs that are, rather than addressing just one risk factor or even just substance use, but multiple risk factors, where there were 2 reviews, both published in 2018. The first one showed that multiple risk behavior programs, interventions decrease adolescent substance use in just one-time multi-health consultations or group sessions. And then the other review showed that universal school-based interventions that addressed multiple risk behaviors had a positive impact on preventing alcohol, tobacco, illicit drug use, antisocial behaviors, and improving physical activity. So these are both reviews of a number of interventions. So I think a good amount of research showing that that interventions that integrate and address more than one health risk factor are likely to be effective and even cost effective. All right, now let's shift gears and take a look at the differences between Prevention Plus Wellness, that's PPW, and other substance use prevention strategies. So we'll go into more depth with I think all of these, but these are some of the unique characteristics of Prevention Plus Wellness programs and media campaigns. Starting in the left on the top, PPW programs address both substance use and the chronic disease risk behaviors. So again, that's that integrated or more holistic strategy or more real strategy of addressing the needs, the health risk needs of average youth and young adults in America. To the right, in the middle box, single session programs and media campaigns permit broad reach, both of them, because if a program is a single session versus 8 or 10 or 15, much more likely to reach more youth. Media campaigns are designed to reach out to many more target population, youth, parents, etc. To the right further, evidence-based screening and brief intervention practices model. That's for the program. PPW programs use a screening and brief intervention model. And according to SAMHSA and other organizations, that's evidence-based practice. So you got evidence-based practice, and then at a lower level, you got individual evidence-based programs. So at a practice level, organizations like World Health Organization and others, SAMHSA, like I said, Substance Abuse Mental Health Services Administration, CDC, et cetera, have identified screening and brief intervention as evidence-based practices. And all PPW programs are screening and brief interventions. And then at the program level, we also have individual PPW programs that have been evaluated and are considered evidence-based programs. So more about that in a few minutes. The lower left-hand column, PPW programs are based on positive image and wellness behavior theory. And I'll go over that It's the behavior image theory, and there's plenty of evidence of using that theory for creating integrated programs and effective programs. Next to the right, PBW programs use multi-behavior goal setting. That's the action piece. That's to get youth to avoid substance use and increase protective lifestyle, healthy behaviors, and then promotes habits, improving mental and physical health. When you're addressing multiple risk factors, you're more likely to improve both physical and mental health. By the way, there's plenty of research and there's quite a bit of continuing research looking at the role of healthy lifestyle, healthy lifestyle behaviors or lifestyle behaviors, nutrition and breakfast, sleep and physical activity in particular, as being linked to improving mental health outcomes, not just physical outcomes. And that's what PBW programs focus on, promoting healthy lifestyles. Other more unique aspects of PBW programs and campaigns compared to other substance use programs, PBW programs are scripted, and that increases the fidelity and the ease and of use of your material. Easily tailored to population study. We'll talk more about this. And many cases, I shouldn't say many, in some cases, you'll want to tailor your images or your content to your population or setting to increase its the message reception as well as potential for efficacy. Content for individual, for group, and for mass media implementation. That's what's available through PBW programs and media campaigns. Built-in immediate pre-post health and, immediate as well as health pre-post surveys to evaluate your program, your PBW programs and media campaigns. So there's multiple built-in tools to assess your PBW program or campaign effects on your target youth. Single purchase includes all the materials that you need for implementation, so you don't need to continue to purchase anything beyond your PBW program or media campaign. You just download it and you're ready to go. Or in the case of a program, you actually get a physical manual as well. And PBW programs address multiple national health education standards. So let's talk a little bit more about some of these unique differences between prevention plus wellness, substance use or health programs, and other programs and media campaigns. First of all, as we said earlier, prevention plus wellness strategies address both substance use and chronic disease risk behaviors, all within the single program and campaign. So what are the substance use topics? Sport and in shape, prevention plus wellness, sport for youth, high school, middle school, elementary school, in shape for young adults. Those address alcohol largely, as well as other drugs. Some of our other programs, like our marijuana prevention plus wellness program, addresses cannabis. Our vaping PPW program addresses e-cigarettes and tobacco, and our opioid prevention plus wellness program obviously addresses opioid misuse. So we have programs that address a range of specific substances as well as generally alcohol and drug use. What about chronic disease risk under number 2? The things that are addressed in most of prevention plus wellness programs and campaigns are: number 1, obesity / screen time / physical inactivity. 2B, environmental influences like friends and family. C, unhealthy nutrition and skipping breakfast. D, lack of sleep. And E, uncontrolled stress. So those are the chronic diseases that are addressed in most of our programs. That said, under number 3, we also address other substance use risk factors. We have a racial justice PPW program that addresses racial discrimination as a risk factor for substance use. And we have a free In God's Image program that addresses not just healthy behaviors and avoiding substance use, but developing spiritual practices, spiritual habits. So a lot of risk factors are addressed in PPW programs. Now, why screening and brief interventions for our prevention plus wellness programs? Well, there was a great review back in 2015 that showed that screening and brief interventions were effective for up to a year after receipt for both adolescents and young adults. Our own research under number 2 has shown that both our sport and our InShape programs, Sport for Youth, InShape for Young Adults, had outcomes even for this one session program, these one session programs, Sport InShape, one session with youth or young adults, still there were some effects even a year after that. And there's been plenty of others that have stated that screening and brief interventions, brief programs, can have an amazing impact on reaching a wide range of youth in diverse settings. Think about it. With a single session program, like most of our prevention plus wellness programs, it's much easier, and media campaigns, it's much easier to reach all youth in your population, or nearly all youth, having a public health reach. And that can really increase the effects overall for that population. And it's much easier to do when it's brief than it is when you have multiple sessions. And I know most of you are aware of the challenges of trying to access youth for providing evidence-based programs and media campaigns. It's very, very difficult. Schools are busy and other agencies and organizations are busy, and yet youth desperately need these prevention messages, prevention, not just the substance use, but these chronic disease risks that are so prevalent among them. Now, what are the just some of the agencies that have identified screening and brief intervention as this evidence-based practice, of which all PPW programs are, screening and brief intervention. SAMHSA, as I said before, the Substance Abuse Mental Health Services Administration has their own model for screening and brief intervention. I know many of you are familiar with this. It's called SBIRT, Screening, Brief Intervention, Referral to Treatment. CDC, World Health Organization, NIAAA, National Institute on Alcohol Abuse and Alcoholism, the American Academy of Pediatrics, and others have all identified screening and brief intervention as evidence-based practice. Okay, so again, you got evidence-based practice, a little higher level of evidence than evidence-based programs, which are specific to the program. Let's look at, however, the evidence supporting prevention plus wellness, screening and brief intervention. So we're going to look at sport. This is our evidence-based program, screening and brief intervention, first of all. And these are the peer-reviewed publications evaluating the outcomes from the single session sport program. And these are a summary of the outcomes found in those studies. Sport single session intervention significantly decreased a whole range of measures of alcohol use: initiation, quantity, frequency, problems, drinking and driving, binge drinking, and number 2, increased physical activity. There's where that integration, PPW program integration comes in. 3, reduced cigarette smoking, with some effects even a year later on that. Number 4, reduced binge drinking, smoking, marijuana use, increased physical activity among drug using, substance using adolescents, with some effects a year later. Increased parent-youth communication. We have 4 flyers that go out to parents in the sport program, and we did a separate study of those separately, and those were found, just the flyers, sending them home, were found to reduce alcohol use, different measures of alcohol use and marijuana, and increase parent-youth communication. And then lastly, the most recent study was a translation of sport into Turkish language, and an evaluation was conducted, a controlled trial conducted in Istanbul for a student in working on a degree in nursing. And they found that youth in Turkey that received the sport program compared to those who didn't improved indices of physical activity, nutrition, health responsibility, and mental health. So lots of evidence supporting this evidence-based program sport prevention plus wellness. At the same time, we have a program for young adults. This is implemented in college campuses, community, even U.S. military. It's called InShape, Prevention plus Wellness. Those are the 5 journals which reported controlled evaluation studies of InShape. And here are the outcomes on young adults that received this single session InShape PPW program. Like sport, you see reductions in the frequency and heavy use of alcohol use, reductions in drinking, driving, even a year later, reductions in the initiation quantity and heavy use of marijuana, increased sleep, exercise, and healthy eating, improved spiritual and social quality of life, and better body image, number 7, and number 8, increased physical activity, general health, emotional wellness, lots and lots of good outcomes from the single session InShape PPW program. So because of this, sport and InShape prevention plus wellness programs are listed on a whole range of evidence-based registries. You can see just a small number of them. You can read a lot more about the program, about the effectiveness of these programs, sport and InShape, and the registry is in all the reports and so on our website, preventionpluswellness.com. So, but we also had other studies, several other studies that examined other kinds of interventions, screening and brief interventions, again, based on our evidence-based, our theoretical model, which we'll be talking a little bit more about in a minute. These are the 3 publications that these other studies were found in. And again, here's the outcomes. These brief PPW programs increased health behavior goal setting, decreased cigarette use, alcohol use, various measures of that increased and decreased problems of substance use. Really good outcomes there, number 1. Number 2, improvements is a separate study, improvements in alcohol, marijuana use, exercise, nutrition, college and career preparation. And 3, improvements in alcohol quantity, frequency, veggie and fruit consumption, relaxation. So multiple behavior outcomes from PPW programs in published scientific and peer-reviewed publications. So what can we conclude from this information that I shared with you? Number 1, screening and brief interventions, that's SBIs, are evidence-based practice for preventing and reducing alcohol and substance use and other risk behaviors which are associated with the mental and physical well-being of young people. Secondly, prevention and health professionals can use screening and brief interventions as a standalone, or in many cases throughout the country, all 50 states and abroad, many organizations, schools, behavioral health organizations, coalitions, et cetera, Boys and Girls Club, on and on, are using our programs as an adjunct or an add-on to their other prevention and health and fitness programs. And not just in clinical settings where most of the research looks at the efficacy of screening and brief interventions, but more recently, screening and brief interventions, including PPW, can be implemented in schools and campuses, communities, after school, just almost anywhere where there's youth, in sports. Summer's coming up, summer camps, everywhere where youth are, I think PPW programs have been implemented. And thirdly, multiple risk behavior screening and brief interventions for youth and young adults may be more cost effective. It makes more sense, doesn't it? If you're addressing substance use and a whole host of chronic disease risk, physical inactivity and sedentary lifestyle, and not eating breakfast and fruits and vegetables, not getting sleep, not controlling stress. If you're addressing that and substance use all in one, that saves a lot of time versus having individual interventions for each of those risk factors, substance use or specific types of substance use, and then an intervention for physical activity and the intervention for nutrition and so on. So these multiple risk behavior interventions can be cost effective and they can be time saving. and then in comparison to single risk behavior programs. How about substance use prevention media campaigns by prevention, just generally, not by Prevention Plus Wellness, just generally speaking, what do we know about substance use media campaigns? Number one, the evidence is mixed. There's some positive effects, some no effects, some negative effects. But that said, they continue to and remain a very popular strategy for influencing knowledge and attitudes and behaviors, particularly of youth and parents. So media campaigns, I believe, are here to stay. Number two, for example, SAMHSA has reported that more and more states are creating media campaigns to address prescription drug misuse. So you can see it just on that particular topic alone. Number three, potentially cost-effective in reaching large numbers. I think that's one of the real drawing cards and benefits of media campaigns. You could really reach everybody in your school district or your community with a media campaign, print media and social media. And lastly, youth are highly exposed to substance use portrayals in print and social media in particular. And these are linked to greater use among youth. And I think that's what a lot of us think about. We think, hey, youth are seeing pro-use messages online in particular, and and research is showing that is influencing their use. So let's combat it with positive substance use prevention media campaigns. As far as research, we have, as I mentioned earlier, built-in pre and post immediate surveys and longer-term health behavior surveys. We report regularly case studies of organizations that are implementing our programs. Many of those are on our website if you want to read more about the successes, and we do leave the door open for partnering with other organizations to continue researching and evaluating our programs and different aspects of our programs in different populations and settings. Now let's look at the underlying conceptual model, the theory behind Prevention Plus Wellness programs and media campaigns. That is the behavior image model, BIM. Behavior image model is a theoretical roadmap, if you will, for anyone, not just us, but yourselves. You can take the behavior image model and you can create screening and brief interventions, like we have many in our portfolio of Prevention Plus Wellness programs, or more recently, our media campaigns. So at least those two types of interventions can be, and I really think the behavior image model can be used for creating other types of interventions as well, other than brief interventions and other than media campaigns. But the key is the behavior image model uses images that can be used to connect healthy behavior promotion. So the opposite side of that coin of chronic disease risk, physical activity and sports, breakfast and nutrition, plenty of sleep and controlling stress, and linking that to avoiding substance use. And so that integrated process, an integrated program or campaign. So for example, a behavior image model can be used to integrate promoting physical activity with preventing alcohol use. So that's the beauty of the behavior image model. A little bit more about the behavior image model. There's three main components. The first is the motivational component. That is the assumption that you can communicate positive, aspirational, both peer and social and future desired images to young people as benefits and as values. And substance use, whether it be opioids, whether it be alcohol, whether it be vaping, e-cigarettes, or cannabis, as harmful and costing the individual youth. And this approach of using these positive images, aspirational images, can be used to connect and to increase motivation for change across multiple behaviors, not just, hey, I want to not use, not vape, but I also want to be more physically active and eat healthier. So that's the first part, the first component of the behavior image model, and the part of all prevention plus wellness programs and media campaigns. Secondly, the second component of the behavior image model is the action piece. This is the piece that gets youth to make a commitment and to make a change, because the goal is to motivate and to change behavior. So the second part uses multiple behavior goal setting and contracting to help young people initiate behavior change and over time increase self-regulation skills, self-efficacy, and positive self-concepts of themselves around those healthy behaviors, physical activity, sleep, etc. And then more recently, the third component is to provide some additional and continued support for youth for the behavior change. So this could be parent materials or training or youth resources or opportunities for youth that support their positive behavior choices, parent-youth communication, youth continued monitoring of their daily goals and weekly goal setting. And we have a number of resources for that. And we have built-in parent flyers and sport and some other things, parent programs. We're continuing to develop more resources in that particular area. After you implement your single session prevention plus wellness program or your media campaign, how do you follow up and support youth in their behavior change process? In terms of the advantages of prevention plus wellness programs scripted content, and what prevention plus wellness programs come with a physical manual, and there's 2 scripts in the manual. One script is to read to one youth at a time. The other script is to read to a group of youth. So you have that flexibility to implement your prevention plus wellness screening and brief intervention to youth individually or in a group, in person or online. It's all laid out beautifully, very flexible. And the advantage of having scripted content is very easy to use, really reduces training time. Now we have training for all implementers for all of our programs, teachers for all of our programs. Right now, the most popular is the self-paced training. And it's very easy, but it takes like an hour, hour and a half, something like that to go through. And if you're talking about training for a multi-session program, a prevention program that's 6 sessions or 8, 15 sessions, it can take hours, days. So that's why having this brief intervention and having it scripted really reduces on that training time. Nonetheless, training is very important, and we highly encourage all of our users to get some sort of training, either the self-paced training or the live online training or the in-person training. The scripted content also increases fidelity and reliability, because if you implement your program using the script in your manual, your PPW program manual today or next week or 5 years from now, it's going to be the same thing. If somebody else implements it using the manual, it's the same program. So that really increases fidelity and reliability, that script. And lastly, a script allows less skilled implementers like youth leaders. So there's organizations throughout the country that are training youth to implement prevention plus wellness screening and brief interventions or media campaigns for that effect to their peers, and the scripts really make that easy. So you don't need to have a master's degree and be a certified prevention specialist or counselor or anything like that, because the content in our programs are scripted. You practice the script, you have the script with you, and everything will go very well. It's all very intuitive. You got slides, works out beautifully. How about advantages of prevention plus wellness media campaign content? Well, it's ready to implement and fully loaded. This will save you and your organization a tremendous amount of time, but also still allows tailoring of your population and setting. So for example, we had a chat with some people from one of our Native American nations out west, and I think taking out some of the images of in our media campaigns or program slides for that matter, and putting in more images representative of that population would allow that population to see models of themselves. And that would be a good and appropriate tailoring, customization of that program. You might want to add extra content to your program or media campaign. For example, one of our implementers, one of our providers, added extra content on high caffeinated beverages because that was a concern. So you have the ability to a certain extent, tailor the program to your needs of your population and setting. Number 4, content adapted in the media campaign. The content in the PPW media campaigns has been adapted from evidence-based PPW programs and from the behavior image theory and from behavior informed sources such as Centers for Disease Control. So good theory underlying, good evidence, good program materials and support for the content in the PPW media campaigns. Number 5, media campaigns target a whole range of things: drug myths, risks, norms, media influences, providing positive role models to youth and parents, providing health behavior screening and goal setting. So we've taken the screening and goal setting from the PPW programs and also included it in the media campaigns. And that promote, of course, healthy lifestyle behaviors, not just avoiding substance use, but gives them something to focus on and increase or improve. Number 6 includes both print and social media materials in all PPW media campaigns, and includes online pre-post evaluations of health behavior. So you can really see, is your media campaign influencing health behaviors? Is your media campaign influencing risk factors for substance use? And that is all covered and measured in the online pre-post surveys in our media campaigns. Let's talk a little bit more about this tailoring. I sort of brought that up a couple of times. Easy tailoring, now some evidence-based programs, they don't want you to tailor. Our read of the research is that, there's just too many variables with evidence-based programs. You take them, there's different implementers, there's different skills, there's different settings, there's different populations, there's different times. Context is very, very important. And so we believe tailoring is not just an option, but is necessary in some cases. So for example, the first checklist right there on the right, program campaign tailoring is encouraged as needed. Number 1, below that, images of participants can be replaced. So for example, and one example was out west, there was a school system that said they wanted to take out images of kids engaged in organized sports, like let's say baseball, and replace that with outdoor activities which were much more prevalent and relevant to youth, like hiking and skiing and fishing. And so great adaptation there, customization, so kids can see representations of themselves, different ethnicities and genders, activities. You want to have the youth see those images in the PPW program slides or media campaign materials so that they can relate to it. The next block down, slide and media content can be expanded. I already gave that example. For example, you can include SMART goal content, a high caffeine drink. So you can add to these programs and media campaigns if you want. Materials can be co-branded with your logo, with your colors. I think that's a particular interest in media campaigns, and you can do that on our program, media campaigns and programs. And then lastly, we only ask that you send anything that's changed. I mean, outside of a logo and colors, that doesn't matter. But if you're going to change the images, if you're going to change and add content, send that to us so we could review it for you, give you feedback, and share the changes with others so we can all learn from that. So tailoring is rather easy and encouraged in cases where it's necessary. Going back to the programs again, and the scripts, there's a script to implement your programs individually or in a group, as I said. This allows flexibility, increases and feasibility. Both scripts use the same PowerPoint slide, so you can toggle or flip back between, implementing your program to one youth at a time, maybe a high-risk youth caught for vaping or alcohol or marijuana use, and then go into a group or classroom or Boys and Girls Club or YMCA and present it to a group of individuals using the group script. The individual script is a little bit more tailored, and research shows tailoring can increase efficacy, so that's likely the more effective strategy. The group script is obviously the most efficient because you get more, you're going to have a whole group, you can get through many more youth at a time than if you implement your PPW program to individuals. Make sense? If you have any questions, let me know. Most scripts are being used across the United States as universal, as well as selective and indicated prevention interventions. In other words, for all youth, but also for higher risk drug using youth or youth with other issues and problems. And they can be implemented, as I said, in person or online. Built-in pre-post evaluation surveys, I had mentioned this, but a little bit more information here. There's two versions of that online survey. The first is the immediate pre-post survey. That works really well with implementing our one-session screening and brief interventions. You can implement the pre-test, launch your lesson, implement your post-test. And if you have the online version, which can be, we could send you a customized link to that, so your data will be separate from everybody else's. You'll be able to track outcomes without having even go through the effort of entering data by hand and collecting data. You show youth the link to the survey or the QR code. They complete it, launch your lesson, complete the goal setting, launch the post-test link or QR code, and you've got your data collected, and you can track data over time. We have it in SurveyMonkey, we'll send it to you. You can see charts and everything. Second survey is under number 3. That's the health behavior survey and a risk behavior, risk and protective factor measures. This is especially good for the media campaigns, which are stretched out over time, or if you want to follow up with your screening brief intervention programs a month or so later, because it does include assessments of 30-day substance use and 30-day health behavior. So a broad range of behaviors are assessed in our health behavior survey. Both of these surveys provide data for you to promote your program and to improve it over time, whether it's your program or your campaign. And again, you get free access to the data if it's online. PPW programs and campaigns address health education standards. You can read more, and I'll be sending you these slides, as I said, so you can click on these links and it goes to our website. But you can go to our website on your own if you want. Just go type in prevention plus wellness, and you'll be able to read more about the health education standards and how PPW programs and campaigns address those, which is very important. Kids need to have these skills, and particularly to be motivated and then learn how to set goals and monitor goals. Prevention plus wellness strategies are implemented in all 50 states and abroad. And as I said earlier, in just about any setting where you can reach youth, so making them very feasible, very practical, all these different settings, faith-based, juvenile justice, counseling, etc. These are the programs. These are the screening and brief interventions that we offer at Prevention Plus Wellness. Sport is evidence-based, as I mentioned, addresses alcohol primarily, but also other substances. We have a high school, middle school, elementary school version. InShape is our other evidence-based program. Remember, all these programs are screening and brief intervention, and screening and brief intervention is evidence-based practices. Sport addresses young adults. We have single session parent programs. So if you wanted to implement, let's say, the marijuana PPW program to youth, and then you wanted to train parents in the youth marijuana program, that's available. So you can really have messages coming from you as a professional, and then from the parents, sort of, so they have that reinforcing positive behavior messaging and goal setting going on at home from the parents. So we have parent programs on our website, all under the heading of programs. We have a vaping or e-cigarette PPW program, high school, middle school, elementary school version, the same with the marijuana. Our opioid program comes in an adolescent version and a high-risk young men and a high-risk young women. We do have one multi-session program called Sport 2. It actually has 6 sessions, high school, middle school, elementary school version. We have converted sport into a video program, so you can have your teacher, your coach, or whatever, just play the video, hand out the screening survey, hand out the goal plans, making it even easier. You don't even need a scripted manual. We also have the racial justice PPW program and the free In God's Image program. Those are our screening and brief intervention programs. We also have media campaigns, 4 of them. These are newer, somewhat newer. We've actually had a marijuana PPW media campaign some years ago, and so we've updated it just recently and re-released it, new and improved. But we also created a sport, which is our alcohol media campaign, a vaping, which is our e-cigarette, and we'll be releasing within the next week or so our final or our next campaign, which is the opioid PPW media campaign. Okay, so how about training? As I mentioned earlier, I think our most popular training is the self-paced online training. We also have 2-hour live program implementer training. We have Train the Trainer online live. We have in-person training, although we've not done much of that since the pandemic, but that is available. And we do have free webinars like this one. So go onto our website, drop in your name and your email, and you'll be on our list for the free webinars. Coming soon, I'm hoping, my fingers crossed. I've been announcing this. I've been getting feedback from a lot of prevention specialists throughout the country and abroad, and we're trying to develop an app or an online course. It looks like it'll be an online course at this time that allows you, as a PPW program implementer, let's say you implement our sport program to a group of youth. What happens after that single session? You don't need to do anything, but we want to create a tool that would allow you as the teacher to continue to track your youth daily goal monitoring and goal setting, to continue that process and develop greater self-regulation and self-efficacy for your young person. So stay tuned for that. So what can we conclude? Number 1, there's plenty of epidemiologic and intervention research which shows that there's a tremendous need for integrations that address chronic disease and substance use risks for young people in single programs campaigns. And that's critical to their physical and mental development. Number 2, PPW programs and campaigns have multiple unique characteristics. We talked about a bunch of them. Screening and brief intervention and mass media formats is one. Multi-behavior positive image focus is another. Scripted and ready-to-use content is another. All of those make it easier, more efficient, and more cost-effective to implement PPW strategies. Thirdly, research theory and practice supports the efficacy of PPW programs as evidence-based practices, screening and brief intervention, and the potential for media campaigns using positive images, positive content, cost-effective prevention of multiple risk behaviors for youth and young adults. Okay, so preventionpluswellness.com. That's our website. You could email me at info@preventionpluswellness. Call us here in St. Augustine at our home office, 904-472-5022 if you need anything from us. But please do go check out our website, preventionpluswellness.com. All right, I finished it early enough so that there's plenty of time, 6 minutes for Q&A. So let me see if anybody or chat. Let's see. So we have some. We got a news network. I'm not sure what that is. I'm a media practitioner based in Lagos, Nigeria, and I'd like to advocate this program via my platforms to create more awareness of this topic. How can we work together to achieve this? Well, I think just off the top of my head, just share our, on your website, just share our link to our website, preventionpluswellness.com. Or, you know, the official is https://preventionpluswellness.com. So that's the easiest to do, is to just share our website link on your website. And we really, really appreciate that. And thank you for bringing that up, and let me know if there's anything else we can do to help you with regard to that. We'd love to get the word out in Nigeria. We've had a lot of interest in our programs for, I think, a number of reasons. One of the reasons, at least, is, again, the focus on physical activity and sports, which is very big in many African countries for youth development. And then a second related to that, I will like to have a downloadable contents of your wellness campaign materials. So that's available. It's for purchase, however, so you'll have to see if that's something you have in your budget, but you can go to our website and check it out, preventionpluswellness.com, under programs, and you'll be able to see what the cost of our downloadable media campaigns are. Okay, thank you so much for your interest, and let me know if I answered your questions or if you had other questions. Okay, let's go ahead and look at if there's any questions under the chat space. I'm going to go all the way back, and it looks like people are just saying hi and good morning or good afternoon, and they're from all over the country and even abroad, and which is awesome to see. So many different kinds of wonderful people working to improve the overall health and development of youth in their regions, which is just a wonderful thing to see. So going down the list, I'm looking to see if there's any questions. There are some nice comments about the presentation, which we really appreciate. And gracias to you. And lots of thank yous. Let's see here. Thank you for knowledge schooling. You continue to share. Thanks. Apart from program, thank you very much. So, all right, any questions, any comments, any other thing that I could address? God bless you all for your tireless work, being prevention heroes in your part of the world. And if we can help in any way, we'd love to do that. And so we do have free resources on our website if you can't afford some of our programs. We do have the webinars, so we try to provide something for everybody so that they can use something that we provide. Let's see here if there's anything else. Is the monitoring tool something you're working on for the summer? That's a good question. We're just trying to work on it as quickly as we can. I mean, I asked several weeks ago, would there be an interest? I had a lot of interest in that. And we're just seeing if it's feasible, because I think that's one of those tools that a lot of prevention specialists, teachers would like to have after they implement, especially our single session screening and brief intervention. What goes on with the youth? If we can have a portal or a course where the youth would go on and track their daily goal success and set goals over the course of, let's say, a month, I think we're thinking of, and allow the teacher to have a platform to monitor that and to communicate with their youth, that would be a plus in terms of extending the intervention beyond that single session. We seem to have lots and lots of interest in that. So That's what we're working on. And again, I'm hoping we'll be able, we'll have something, some kind of a strategy. I'm just hoping it'll be, something that's feasible for everybody. Can I partner with your agency? Yes, you're welcome to partner with the agency. Partnerships mean different things to different people. So I'd love to talk to you about partnerships. Send me an email. Let me know what you're thinking of in terms of a partnership. A true partnership is sometimes difficult to achieve, where both organizations achieve something from that partnership, but we're happy to support you any way we can. So please do let me know and reach out to me. Our email is info@preventionpluswellness.com, or you could reach me through our website, preventionpluswellness.com. Let's see, is the monitoring tool something we work on? I'm asking because that would be good for VFD to have during the next school term as we enter schools. Yes, I absolutely agree with you. If it's something we can't do, and again, we've been really working on this hard, and there's a lot of barriers to these kinds of tools, these online tools. We'll have something we'll be able to offer. And so, but I'm hoping that'll be something that will be achieve and be practical, be easy, and yet really achieve that goal of staying in touch with your youth and extending your intervention. I see Vicksburg Family Development. Thank you. All right. Thank you guys for everything, for spending the time with me. Have a wonderful day. Enjoy yourselves. Take care of yourselves and somebody else. And stay in touch with our next webinar as well. Bye, everyone.